Hi, I'm Shivan Sarna. I am the founder of Chronic Condition Rescue. I'm also the founder of Chronic Condition Research, which is a nonprofit which funds discussed and underfunded medical conditions. The whole thing got started about 7 years ago when I created SIBO SOS, Small Intestine Bacterial Overgrowth SOS, which originally was, please come save me, big doctor in the sky. And it turned into Save Ourselves. This was very organic. I couldn't have planned it better. And I'm still extremely pro-practitioner, particularly pro-practitioner of those practitioners that stay up to date with the research, because thankfully the research is coming in so quickly and so fast. But and deep respect to those that do keep up with it or even attempt to keep up with it, because it is so vast and so hard. But that's what this is all about. I wrote a book called, excuse my armpits and this breach, Healing SIBO. So if anyone does have some IBS or SIBO, it's a great resource. And I've done 11 summits, including the Lymphatics Rescue Summit, fascia, biological dentistry, liver and gallbladder, microbiome, SIBO, IBS, and I am working on a menopause summit called the Science and Wisdom of Menopause, What Every Woman, and then in parentheses, person needs to know. And that's coming out first quarter of next year. So I will keep you posted. All right, I'm going to hand things over right now to Sarah Ellis, who I'll have her introduce herself. She is with Microbiome Labs. She is an educator and one of the people that I turn to for expertise in this area. We do have some special offers for you from Microbiome Labs, including a coupon for anything from their website and their site, including their stool test and their vaginal microbiome test. And I'll give you that information shortly. That I will pop into the chat. I've got to grab those links. That being said, I'm going to hand things over to you, Sarah. Thanks for being here.
Thank you for having me, Shivan. Hi, everyone. I'm so glad to be back with you all today. We are going to be spending a wonderful time together talking about gut dysbiosis and really the ways that it impacts our entire body. So not just focusing on the gut, but really the gut organ axis. My name, of course, is Dr. Sarah Ellis. I'm a naturopathic physician and a clinical science liaison with Microbiome Labs. So we have quite a bit of information packed in this slide deck today. So let's get started. Make sure that my cursor is working well. There we go. So during our time together today, I'm going to go over a brief overview of gut dysbiosis. We'll talk about the differences between a healthy and a leaky gut. And then we'll get into the fun stuff. So we'll talk about the impact that gut dysbiosis has on the brain, the heart, lungs, our endocrine system, our immune system, and then we'll end with the genitourinary system. So let's get started with talking about gut dysbiosis. Now, gut dysbiosis can be defined as a reduction in microbial diversity, and it often features a combination of the loss of beneficial bacteria as well as the rise of pathogenic bacteria. If you're looking at a stool test, here are some markers to look for that are clear signs of gut dysbiosis and/or leaky gut. Oftentimes, you'll see decreased diversity. So you're going to see a decrease in alpha diversity, or the number of bacteria in the gut, as well as a decrease in beta diversity. So a decrease in the level and abundance of healthy bacteria in comparison to pathogens. You may also see a decrease in protective keystone species and beneficial byproducts like short-chain fatty acids and vitamins. Gut dysbiosis can also look like an increase of pathogens, an increase in harmful byproducts like histamine and hydrogen sulfide gas, as well as increased inflammation. I also wanted to take a moment to highlight the different ways in which dysbiosis can show up. So, of course, with homeostasis, we have a great balance of a lot of different types of bacteria, as we see up here in the green. But then down below, dysbiosis can look like an overgrowth of pathogens, as you can see here with the red bacteria, Or it can look like reduced diversity. So instead of having all of these wonderful different types of bacteria, we instead only have one or two or just a handful of species. And then, of course, dysbiosis doesn't necessarily have to look like an overabundance of pathogens, but it could instead look like a reduction of beneficial and health-promoting bacteria. So now let's take a moment to talk about some risk factors. What are some habits, behaviors, and exposures that can cause gut dysbiosis and cause an imbalance in the types of bacteria in the gut? Well, of course, we have prescription antibiotics, natural antimicrobials, pesticides, infections, excessive alcohol use, smoking, stress, poor sleep, intense exercise, and of course, having a poor diet that's usually the standard American diet that is rich in saturated fats. When we take a look at this list, we can see that a number of these things we're exposed to daily just because of our lifestyle with the high stress and sometimes sleep. But we may also see that a lot of these risk factors are things that we may be exposed to unintentionally or with the hope of improving our health, like with antibiotics and natural antimicrobials. So let's take a moment to talk about a healthy versus a leaky gut. On the left, we have a healthy gut that has low levels of pathogens, a strong mucosal barrier, low mucosal inflammation, strong tight junctions that keep these colonocytes tight and close together. And then when we look at a leaky gut over here on the right, we're going to see an overabundance of mucus degrading and toxin producing pathogens. Specifically, we're also going to see quite a bit of a common endotoxin, lipopolysaccharide, or LPS. The presence of LPS and these pathogens are going to impact that intestinal barrier. So we're going to see weakened tight junctions and more space between these colonocytes.
Sarah, be sure to define what LPS is and what the implications are. Okay, thanks. I'm sure
Absolutely.
you were about to, but just in case.
Yeah, no worries. Thank you. So lipopolysaccharide is an endotoxin that's present on the surface of gram-negative bacteria. When it's inside of the bacterial cell, there's no issues at all. Oh, excuse me, got my cursors. There we go. There's no issue at all when it's inside of the bacteria, but when it lyses or dies, that toxin can spill out, cause inflammation, weaken those tight junctions, and lead to leaky gut and issues with dysbiosis. You may have heard our co-founder, Kiran Krishnan, talk about metabolic endotoxemia, and that is essentially what happens when we have too much LPS and it crosses into circulation. What we'll see is when LPS makes contact with the colonocytes and the colon cells, it does lead to inflammation and activation of our immune cells. With the IL-6, TNF-alpha, and IL-1 beta cytokines that kind of turn on the immune system. Again, when we're looking at a stool test, there are a couple of things that can show how dysbiosis can change the core of the microbiome. So when we're looking at alpha diversity, this patient has actually quite a low alpha diversity. So they have 98 species of bacteria. And generally, we would say, oh, wow, that actually seems like a lot. But we actually want to be closer to 200. So we really need to double the number of bacteria that's present in this patient's gut. And then you'll see that the distribution of the different types of bacteria is off as well. So we see a lot of inflammatory bacteria like proteobacteria, as well as an imbalance in the 4 and 5 main groups of bacteria in the microbiome. So these are all of the different ways that a stool test like BiomeFX can highlight the presence of dysbiosis. Now, the type of bacteria that's present in the gut is important. So because bacterial contributions of a healthy gut are very different from the bacterial contributions from a dysbiotic gut. So for example, our commensals and good bacteria, they make short chain fatty acids, vitamins, antioxidants, neurotransmitters, and they even have the ability to optimize the gut pH that helps the good bacteria grow and thrive. But if you have more opportunistic and pathogenic bacteria, then we will tend to see an increase in byproducts like ammonia, hydrogen sulfide gas, methane, toxins and virulence factors, and lipopolysaccharide, that endotoxin. What we know from the research and with clinical application, we know that gut dysbiosis impacts the entire body. It impacts our metabolic dysfunction and metabolic action. It plays a role in autoimmunity, skin conditions, nervous system disorders, including not just neurocognitive issues or neurodegenerative issues like Parkinson's, Alzheimer's, but also mood disorders like anxiety and depression. We also see that with hormone balance, the gut microbiome plays a big role in liver health as well. This schematic shows how the gut microbiome is connected to so many organ systems. And this is kind of what we'll be spending the next about 45 minutes talking about today. So let's jump right on in. We're going to start head to toe, and we are going to discuss dysbiosis and the gut-brain axis. All right, so our gut is powered by its own nervous system, the enteric nervous system. And there are a lot of neurons in the ENS. In fact, there are more neurons in the gut than there are in the entire spinal cord. So over 100 million neurons are present in our gut. And all of this is accessible to the microbiome. Now, the gut-brain axis is a bidirectional communication pathway where the gut communicates with the brain and vice versa. Now, this communication is impacted not just by the bacteria that's in the gut, but also the hormones that those bacteria can make. The production of different hormones and neurotransmitters like norepinephrine, dopamine, and estradiol all have an impact on how the bacteria grow, whether or not they establish biofilms, whether they have a decreased resistance to the host protective measures like the immune system, and it can impact their virulence as well. So the connection between the gut microbiome and the bacteria and the things that they make definitely has an impact on our brain and vice versa. And the main way in which the gut is able to communicate with the brain is the vagus nerve. So again, the gut-brain axis is a bidirectional communication pathway mostly conducted by the vagus nerve, and it involves the vagus nerve, the brain, and the spinal cord. It also involves our endocrine system, specifically the HPA axis, and that is the hypothalamus, pituitary, and adrenal gland axis. It also involves activity with the immune system and the gut microbiome. Now, again, the enteric nervous system not only includes nerves and neurons, but also over 30 different neurotransmitters that act within the enteric nervous system. And hormones like ghrelin, for example, our hunger hormone, the hormones that are produced in the gut, many of them can cross the blood-brain barrier. And so that's, again, another way in which products that are produced in the gut can make their way to the brain and impact brain function and activity. Now, it's important to note that even though this is a bidirectional pathway, they don't communicate with each other in the same way. So think of this as a relationship between an extrovert and an introvert. How many of you can guess that the gut is definitely the extroverted friend? So the gut is always chatty, 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 telling the brain, I'm hungry, I'm full, we ate this, we made this. And the brain is really the introverted friend. So it doesn't really have much to say, but when it does, it's very impactful. And so this tells us that everything that's going on in the gut is definitely going to be shared with the brain and vice versa. So it's important to make sure that we have a healthy gut and a healthy microbiome. Now, the vagus nerve is our 10th cranial nerve that sits at the base of our skull, and it is our longest nerve. It innervates the pharynx and the larynx. It actually plays a huge role in swallowing and our gag reflex. It also innervates our chest and thorax and is able to provide parasympathetic activity. So think rest and digest as we come down from a stressor. In fact, the vagus nerve plays a big role in reducing our heart rate and blood pressure. It also innervates the intestines and is responsible for smooth muscle contraction, secretion of hormones, and many other functions. And then, of course, the vagus nerve has receptors in the esophagus, the stomach, the small intestine, and even has sensory endings in the liver and the pancreas. Now, the vagus nerve is responsible for regulating internal organ function. So this is the nerve that's responsible for digestion, heart rate, and even respiratory rate. And it also plays a role in vasomotor activities in certain reflexes. So remember, I mentioned the gag reflex. That is associated with the vagus nerve, along with coughing, sneezing, and even vomiting. Now, all of this is really important because of the rise of functional GI disorders, or FGIDs. And this is important because all of them have been shown, all of these conditions have been shown to arise when there is a dysregulation or an imbalance between the way the gut and the brain communicate with each other. All of these conditions, like functional dysphagia, functional dyspepsia, IBS, they all are characterized by a similar constellation of symptoms. So they all have similar shared symptoms: abdominal pain, dysphagia, dyspepsia, diarrhea and constipation, and even bloating. Now, what's important to note is that these conditions can make up over 30% of an outpatient gastroenterology visit. They're often also paired with chronic pain issues like fibromyalgia and even other functional syndromes like chronic fatigue syndrome. So the gut-brain axis and dysregulation in the gut-brain axis doesn't just impact, the gut and also neurocognitive function and activity, but it can lead to making someone more susceptible to other conditions as well. All right, we have a pop quiz coming up. Which of the following is considered a cause of gut-brain axis dysfunction? LPS endotoxemia, fasting, infections, or none of the above? So I'll give you all a few moments to hop in the chat. We'll take a look and see what everyone's answers are looking like.
For this one, C, candida infections.
All right. We have some C's and A.
Another A.
Great job, everyone.
I think it's
All right.
A, so I don't know.
ABC. Okay, good job, Ken. All right, the answer, let me get back to my screen. The answer is actually A, LPS endotoxemia. So remember that toxin that we talked about earlier that's on the surfaces of gram-negative bacteria? That is one of the main causes of gut-brain axis dysfunction. And so we're going to talk a little bit about that in these coming slides. All right, LPS. It's an endotoxin by gram-negative bacteria. Now, gram-negative bacteria make up 50 to 60% of the bacteria in our gut. So that toxin is pretty ubiquitous and present in our microbiome. Now, remember, when it is inside a bacterial cell, it is no issue to us. But when the bacteria dies, it lyses open and releases that toxin. And that's when we get the inflammation and subsequent issues from that. Now, When we have LPS that's in the gut and someone has leaky gut, that LPS can go through those weakened tight junctions, enter circulation, and one of the first places that it's going to go to is the brain. And when it's in the brain, it can wreak havoc. Let's talk about this kind of first study. So this is a study looking at the connection between major depression and gut-derived lipopolysaccharide. And what they found is that, the presence of LPS and those inflammatory cytokines did play a role in the symptoms that patients experience with depression, as well as the severity of their major depressive disorder symptoms. Here, what they found is that patients that had anxiety and depression had fewer short-chain fatty acid producers. So remember a couple of slides ago, I said that the bacterial contributions of your microbiome are very different if your gut is healthy or dysbiotic. A healthy gut will make more short-chain fatty acids. And so patients with anxiety and depression saw a reduction in those beneficial bacterial strains and an increase in the inflammatory and pathogenic bacteria. Other factors that played a role in this is diet, of course, whether or not they were taking psychiatric medications, and then also how they stratified their symptoms, and of course, gender and sex as well. Now let's talk a little bit about lipopolysaccharide and its impact on Alzheimer's disease. So we just saw that LPS can coincide or worsen depressive symptoms. And here, this study found that they actually saw gut-derived LPS in the beta amyloid plaques in the Alzheimer's brain. So with these patients, they found that LPS was able to cross the intestinal barrier, get through circulation, cross the blood-brain barrier, and made their home in the beta amyloid plaques of the Alzheimer's brain. We also saw a connection between lipopolysaccharide and Parkinson's disease. In fact, they found that the increase in inflammation caused by the LPS also just further drove leaky gut and exposure to those endotoxins. And that inflammation and presence of toxins actually increased those aggregations that we tend to see in patients with Parkinson's, and that could worsen the Parkinson's disease as well. Now, one of the ways in which lipopolysaccharide impacts the brain is by changing the way in which tryptophan is used. So tryptophan is a essential amino acid that plays a huge role in many processes in our brain and in our overall health as well. So again, here with the red arrow, we see that LPS is a pro-inflammatory toxin, so it causes inflammation in the body. When it crosses across that intestinal barrier, a leaky gut, it will activate immune cells and turn on the inflammatory process. When this inflammatory process is turned on, it increases an enzyme called IDO. Now, IDO is important because this is the enzyme that is going to take tryptophan and send it into a toxic pathway, rather than allowing it to be used in a healthy way for us to make more serotonin and melatonin for good sleep. So here we see that because LPS increases this enzyme, we're going to have fewer amounts of tryptophan to help balance our mood and our sleep. And it has an impact in the way that our body is able to make important neurotransmitters. So let's take a look here. We see here at the top that we get tryptophan either from our diet or our bacteria can make tryptophan. In a healthy person with a healthy gut, tryptophan can be used to make serotonin, which keeps our mood nice and balanced, as well as melatonin to help us with good sleep. So when we have tryptophan going down that healthy pathway, you will have patients that have better sleep, a balanced circadian rhythm, a positive outlook and balanced mood, as well as a good memory. But if you have a patient with high stress, chronic stress, and inflammation due to lipopolysaccharide, that upregulates and kind of increases this enzyme that takes tryptophan down this toxic pathway. And when this toxic pathway is turned on, we are able to make less serotonin and less melatonin. And so now on the other end, you'll have patients with a depressed mood, more irritability, poor sleep, and poor memory. By decreasing gut inflammation and decreasing that LPS toxin, we'll be freeing up tryptophan to be used in a healthy way. All right, so let's keep on going. And now we're going to talk about the gut-heart axis. Let's see how we're doing on time. Doing good.
Yeah,
All right.
you're doing great.
Awesome. Perfect. So here's what we know. Dysbiosis plays a critical role in the development of not just chronic disease, but cardiovascular disease as well. There have been several studies that have connected nutrition, the microbiome, and leaky gut to the development and promotion of cardiovascular disease. Now, there are several microbial metabolites or byproducts that the bacteria make that can impact the development of cardiovascular disease. So today we'll talk a little bit about TMA and TMAO. We'll continue the discussion about LPS. And then also some other byproducts like bile acids, and short chain fatty acids can impact heart health as well. So let's start with some foundational information on TMAO. Trimethylamine N-oxide, or TMAO, is produced in the gut after we eat foods like seafood, dairy, eggs, and carnitine from meat. When that happens, the gut bacteria turns choline and carnitine into TMA. Now, TMA is not an issue, but when TMA goes into the liver turns it into TMAO. And then we have a lot of issues because TMAO is known to cause atherosclerosis, or hardening of the arteries, and worsen worsen heart disease. Now, again, TMAO is associated with atherosclerosis, type 2 diabetes, metabolic syndrome, heart attack. We mentioned atherosclerosis already, and even chronic kidney disease progression. In a meta-analysis of over 19 studies, they found that the higher the blood levels of TMAO, the more increased risk a patient had to experience cardiovascular events like a heart attack, stroke, and even death. Now, one of the great things is that having an increased microbial diversity, so more bacteria and a better quality of bacteria, has been shown to decrease the levels of TMAO that's produced in the body. So now let's talk about dysbiosis and atherosclerosis, so hardening of the arteries. There's a 2017 study that looked at over 218 stool samples of patients that had atherosclerotic cardiovascular disease. And then they also looked at the stool samples of 187 healthy patients without heart disease. And when they compared the two groups, what they found is that the patients with the atherosclerosis had more pathogenic bacteria, so E. coli and Klebsiella and even Streptococcus. And they also had fewer butyrate or short chain fatty acid producing bacteria like Faecalibacterium, Prosnitzi, and Bifidobacterium. They also showed an increase in inflammatory biomarkers and metabolites like TMAO, hydrogen sulfide gas, histamine, and LPS. But they also saw a decrease in the gut's ability to ferment healthy fiber and subsequently a reduction in the production of short-chain fatty acids. Now, there is a feature in this study that I found very fascinating, is when they took samples of these atherosclerotic plaques from the blood vessels, they actually found bacterial DNA in those plaques. So it's showing the connection between having a leaky gut and gut dysbiosis, and its impact on the development of atherosclerosis and heart disease. Now, this is a table from that paper, and it can be a little overwhelming to look at, but let's walk through it and kind of take our time with it. They looked at different types of cardiovascular disease, so coronary atherosclerosis, so hardening of the arteries that feed the heart, high blood pressure, and even heart failure. And they looked at the changes in the microbiome that tends to happen with the cardiovascular disease. They found that TMAO was more associated with coronary atherosclerosis, as well as some bile acids and LPS as well. The production of short-chain fatty acids, so not having enough short-chain fatty acids, has been associated with hypertension. And then the same, not having enough short-chain fatty acids and TMAO, having too much TMAO, has been associated with heart failure. So let's talk about coronary artery disease. So again, this is a disease of the blood vessels that supply blood to the heart. And a 2019 clinical study showed that the gut composition, or the types of bacteria in the gut, and I'm going to apologize if you hear my dog barking. She's a Chihuahua, so it doesn't take much for her to chime in.
We love animals. It's all good.
Okay, good. But this 2019 study showed that, the composition of the microbiome and the different type of products that it makes does change and align with the severity of coronary artery disease. So the more dysbiotic someone's gut was, it correlated with a more severe presentation of coronary artery disease. And when they looked at the stool samples from patients with coronary artery disease, again, they found similar patterns. So having more pathogenic bacteria like proteobacteria that have LPS, Klebsiella, an increased production of toxic metabolites like TMAO and hydrogen sulfide gas. And of course, a decreased production in short-chain fatty acids, particularly low levels of butyrate. And then lastly, let's talk about how dysbiosis impacts hypertension. Now, hypertension is the most common risk factor associated with cardiovascular disease. It also impacts kidney function and really all of our organs in our body. And so this study was actually really interesting, that showed the changes in the gut microbiome associated with hypertension. They found that patients with high blood pressure, in their stool sample, they found that they had a reduced amount of diversity, so low numbers of bacteria and poor quality of bacteria. They also saw an increased abundance of the genus Prevotella and imbalances in healthy bacteria versus pathogenic bacteria. But I wanted to highlight the fact that the neurotransmitters that are produced by our bacteria can impact our autonomic nervous system. And you may recall that our blood pressure is controlled by our autonomic nervous system. So it happens just naturally. And so the neurotransmitters that our bacteria makes can impact vascular tone and our sympathetic nervous system, and thus impact blood pressure. Now, what is interesting is that elevated levels of TMAO is positively associated with high blood pressure. So the more TMAO they found in a patient's sample, that was associated with them having hypertension. But what was really interesting is there was an animal study where they took the stool from patients with high blood pressure, and they did a fecal microbial transplant into germ-free mice. So these are mice that have no bacteria at all in their body. And when they transplanted the stool from hypertensive patients, those mice developed high blood pressure. So it really highlighted the connection between the gut microbiota and our blood pressure. So now let's talk about the lungs, the gut dysbiosis and the lungs.
You need to hold on for just a second, Sarah.
Yes.
Let's just have a moment where I don't know about everybody else, but I'm sitting there going, huh, really? Really? Huh, wow.
Isn't that fascinating?
And like, not like I'm truly surprised because it's all connected, but huh, that's really very exciting and very cool.
It
So
is.
I don't know if you, today I just read an article about how a very small study was done about the microbiome, gut microbiome, and autism, and that autistic children, and I think it was adults, I'm not sure, have a different microbial makeup too. So, and they also archaea and stuff like that. So it's so interesting. I do need to do a time check because we have so many questions and I don't want to rush you. On the other hand, how many more slides do you have? What's your timing?
I probably have about 20 more minutes, but I could jump through because it's quite a few things to go.
But I owe my people the questions answered as well. So
okay. So let's.
And by the way, everyone, you will be getting a recording. So if she does speed it up, you can just play the replay back on a slower speed.
Exactly. All right, well, let's jump in. Okay, the lungs. Gut dysbiosis has been associated with the presence and development of asthma. So many of you know that asthma is considered an atopic disease, much like eczema, in which the root of these diseases is associated with gut health. And so they found that the changes in the gut microbiome in patients with asthma definitely differs from healthy patients. So, of course, with asthma, you can have different presentations. So you can have allergic or atopic asthma, late onset, kind of adult asthma, exercise-induced, obesity-related, all of these. But what they found is that the endotypes, which is the connection between the way that the bacteria is associated with the different types of asthma, we noticed that with type 2, what they call type 2 asthma, there was an increase in pathogenic bacteria like Klebsiella and Streptococcus. But there was also a decrease in some beneficial and protective bacteria like actinobacteria. Whereas on the other hand, with non-type 2 asthma, we saw a bit of a difference in the types of bacteria that was present, particularly around the Lactobacilli family. And that was a quick overview of the lungs. Now let's get into the endocrine axis. So here we're going to start and talk about two hormonal pictures. So we're going to talk about diabetes and thyroid health. With diabetes, they have found that gut microbial diversity plays a huge role in the development and onset and progression of diabetes. They found that many patients with diabetes have low diversity. I feel like that's a trend that we're seeing across these diseases. But metformin, which is the first line pharmacotherapy for diabetes, actually acts on the gut microbiota and not on the pancreas. Metformin has been found to increase butyrate production, increase propionate production, which is an important immune-related short-chain fatty acid, and increase levels of a protective strain of bacteria called Akkermansia muciniphila. Metformin also can change the type of bacteria that's in the gut. So we found that we had less butyrate producers, or really lower butyrate producers like Roseburia, and a bit more proteobacteria, which meant more inflammation. Okay, thyroid. Now, this is one of my favorites to kind of talk about because it ties into LPS and our ability to kind of detoxify LPS. So our thyroid hormones, are T3 triiodothyronine and T4 thyroxine. Our thyroid and our thyroid hormones impact literally every single part of our body, as we can see here between heart rate, liver, menstrual cycle, all of those things. A disruption in the gut microbial composition has been associated with Hashimoto's thyroiditis, Graves' disease, and Graves' orbitopathy. Now, what's important to note is that there's an enzyme produced in the small intestine called intestinal alkaline phosphatase, or IAP. Now, this enzyme, the production of this enzyme is driven by thyroid hormone. And so if someone has hypothyroidism, like Hashimoto's thyroiditis, they're going to make less and less of this enzyme. Now, this enzyme is important because it helps detoxify LPS. It breaks LPS down so it doesn't activate our immune system and inflammatory processes. But if you have low thyroid, you're going to have low levels of this enzyme, which means your body is not going to be as efficient in breaking down LPS, and you're going to be more likely to have metabolic endotoxemia or issues caused by gut dysbiosis. This one I will leave for you all to read once you get these slides. Essentially, this is looking at the different species of bacteria that's been associated with the expression of popular or common antibodies associated with autoimmune thyroid disease. All right, let's see how we're looking. Okay, we're doing good.
Okay.
Okay, I'm going to
I have 50 questions, so
okay. The overall aspect of the gut dysbiosis in the immune system is that it can impact how our innate immune system, or the first line of defense, how it becomes activated. And so gut dysbiosis can result in a less resilient and a less responsive immune system if we do not take the time to rectify the gut dysbiosis. So here we see that early in life, when we have the ability to build our immune system through birth and in breastfeeding, it actually helps us develop our immune system. So early life, having good exposure to good bacteria helps our immune system create different types of T helper cells. So Th1, Th2, and Th17, they're our inflammatory T helper cells that fight infections, whereas the regulatory T cells cool off that inflammation and help us move past it.
Lastly, let's discuss the gut
microbiome. Sorry, excuse me. I think I still have my audio on there. But let's talk about the genitourinary axis and the gut. So here with the vaginal microbiome, unlike the gut, we like to see, we don't want to see a lot of diversity in the vaginal microbiome. So remember I said in the gut, we want lots of bacteria and lots of different types of bacteria. But with the vaginal microbiome, we really only want to see one type of bacteria, and that's lactobacillus. Lactobacillus helps get rid of pathogens by producing lactate and other bacteriocins and hydrogen peroxide. And it also prevents pathogenic bacteria from adhering to the vaginal mucosa and causing conditions like BV and chronic candida infections. I'll let you all read through this, but these are dysbiosis risk factors associated with vaginal dysbiosis. And here, this highlights the connection between the gut or the colon and not just vaginal health, but also urinary health. And that's due to the proximity of the anus, the vagina, and the bladder. Again, we know that having a dysbiotic gut makes you more at risk of having vaginal dysbiosis, again, due to the proximity and the ability of the bacteria from the colon to reach the vagina. Now, these are the last set of slides. I wanted to talk about this because I know we have quite a few patients that struggle with bladder issues, especially menopausal and postmenopausal women. So a healthy bladder is mostly lactobacillus species. But if a woman has recurrent UTIs, they found that the bladder has been colonized by E. coli, Pseudomonas, and Streptococcus. If you have interstitial cystitis, they found that the bladder is then colonized by Citrobacter and Serratia. And then also if you have overactive bladder, it could also be colonized by these bacteria here. All right. Thank you for your time today. Let's get into these questions.
Well, of course, we need to talk about about Megaspore because this part. Can you go over? People are saying we know we got issues. What are the solutions? And then if you have a question, please do put it into the Q&A box. Ekaterina, beautiful name. Do put it into the Q&A box. And you could actually literally Google today an autism microbiome study because I just saw it in my newsfeed today. Let's put some love into the chat for Sarah. You taught us so much. Thank you. Talk to me about Microbiome Labs and the Megaspore, and also the quickly. We'll do that first, and then I have a couple of other stacked questions for you. Okay.
So Megaspore, we've done a number of studies to show its ability to reduce LPS and LPS's ability to cross into the bloodstream. So I'm sure many of you have heard our landmark study story about how we bribed college kids with a high-fat meal. And we found
like we don't. I love that story. Go ahead.
Yeah, so we went to the University of North Texas and bribed some college students and said, hey, if we give you a free meal, will you please give us your blood so we can, measure your endotoxin levels? And of course, no one's going to turn down free food when you're in college. So we gave them the high-fat diet or high-fat meal, sent them to their dorm with 1 bottle of Megaspore and asked them to come back in 30 days. After 30 days, the probiotic group, in comparison to the control group, saw a 42% decrease in LPS. And in fact, exactly, yes. And in fact, the control group, their LPS levels actually went up. So it was a 65% decrease between the control levels and the probiotic group.
Okay, so here's the deal. Here's the deal. I'm gonna just do this. I know you have a lot of questions. We usually just stop at in 12 minutes, but if you have a little bit of extra time, I will move my next meeting so we can do this. Also, if you want to go to Microbiome Labs, which is who Sarah's on, their educational and scientific team, we have a 15% coupon for you. The link is in the chat. You can use patient code direct SIBO SOS. And then if you do so, you just decide purchase, and we'll go over a little bit more about the products, but I am getting to your questions. By 5 p.m. Eastern time, we will send you her slides. That is just a bonus for people who order between now and 5 p.m. And then also Kiran Krishnan, who is the co-founder of Microbiome Labs and one of the world's leaders in educating and researching people about the microbiome. We have a presentation I did with him on a microbiologist perspective of the microbiome, where he talks about spore-based probiotics, which is what Megaspore is. And that is also a free bonus if you decide to purchase anything from Microbiome Labs by 5 p.m. Eastern. And in that little chat message, you have to send me proof of purchase. People were just emailing me before and saying, I bought, please send me proof of purchase, because we are reaching thousands of people, and do that tonight. That's my ask. Okay. When it comes to the stool tests at Microbiome Labs, the Biome FX, as in the letters F and X, what makes that test so special and different? Because that was one of the questions.
So glad you asked. Really, it's the technology. So a lot of other stool tests use something called 16S RNA technology, which has been tried and true. It's been around for quite some time, but the newest form of technology on the block is whole genome sequencing. And so the difference between the two is 16S RNA really takes a couple of pieces from the bacterial genome and kind of guesses who's present. It gets most specific at the genus level. Whereas whole genome sequencing, we have access to the entire bacterial genome. So we're able to say more accurately who is present in the gut down to the strain and species level.
Got it. Got it. Got it. The Megaspore is 15% off. Yes. How does it go? So I don't usually like to ask about competitors on these situations, but how do you feel that if you're comfortable saying, and we can pass, compared to some other of the more famous stool tests out there? And if you're not, move on. Seriously.
Yeah. So what I can say is that the difference between BiomeFX and our competitors is going to be, again, having a more accurate picture of the microbiome. And we're really focusing on function. So we are specifically looking at the bacterial DNA that's associated with the bacteria in the gut. And so it's really designed for most patients, but particularly those with more complex presentations, to give us more comprehensive information on what's going on in the microbiome.
Okay. Okay. So would someone with interstitial cystitis use a catheter to input the probiotics?
Good question. So I'm not sure if I would use a catheter. I wouldn't. We found that ingesting oral probiotics has been quite effective, as well as even vaginal suppositories. So vaginal suppositories, of course, the location and proximity between the urethra and the vagina is going to allow some translocation of that healthy bacteria. And so there are a couple of lactobacillus-based vaginal suppositories that could potentially be helpful.
Okay. If you're in the UK, yes, you can still order. Go to the website and there should be a way for you to order. And they certainly do have a customer service email. Do you know that customer service email, Sarah?
I know the website is microbiomelabs.co.uk.
Oh, that's helpful. Okay, great. Okay. I'm just going to whip through these. So give me sound bites. How do you starve bad bacteria and yeast without starving yourself?
Good question. Dietary fiber and spore-based probiotics. The spores will kill off the pathogens, and the dietary fiber and prebiotic will feed the good bacteria.
And remember, this isn't medical advice. This is just information for you to learn and make your own decisions and speak with your practitioners as well. What is the connection between SIBO and EPI? Does one cause the other? And we need a definition of EPI.
Exactly. I was going to ask, what does EPI? EPI?
If this was an anonymous attendee, and that was about an hour ago, so if you can just go ahead and chat that to me. Christopher, how can you have an overgrowth of strep and fusobacterium in the gut? Since they are typical in the oral microbiome, does that mean they don't get destroyed in the stomach?
That's exactly what that means, Christopher. Usually when we see oral microbes in the stool, that's a sign you need to work on that stomach acid.
Exocrine pancreatic insufficiency. Thanks one and all for that. I appreciate that.
Yes. Okay. So in many ways, it could be SIBO, small intestine bacterial overgrowth, could potentially be associated with EPI because you're not digesting your food as well. And then the bacteria in the small intestine can gobble up on that food that's not as well digested. So it could be a chicken and the egg situation. But usually once we resolve one, we can resolve the other.
How do you do proof of purchase? Go to my little long paragraph there that I put in the chat. I will repost it. There is an email for you to send your proof of purchase to, and it is to my very small but very special customer service team. And that's why I prefer if you guys do the purchase by 5 p.m. Eastern time. You send it tonight, so it's a heavy lift. So if we do it tonight, it's done, and then they can get back to their regular work tomorrow. So there's an email address right there. Okay. Hey, Cam, what is the effect of dysbiosis on prostate health? Thank you, Cam. Equal opportunity questions here.
Yeah. I would have to look that up. I do not have that information on the top of my head, but I would imagine there's definitely a connection between the gut dysbiosis and prostate health.
All right. Okay. Let's see. Hold on. And by the way, when it comes to your Megaspore, You can start, let's get some logistics for everybody, Sarah. You can start very, very small. Please do start small. Open the
Yes.
capsule. Take like an eighth of a teaspoon, sprinkle it on your food, throw it in your
Mhm.
mouth, whatever you need to do. But you can start that small, right? And build
You
up.
sure can. You sure can, and work your way up.
Okay. When someone has the Herxheimer reaction, is that something, or as a result of too much lipopolysaccharides out of the cell?
Yes, usually a Herxheimer reaction or die-off is associated with an influx of LPS and other toxins. Adding in a binder like mega IgG can help with that.
And that's also at Microbiome Labs. When you take your Megaspore before, during, or after a meal?
I say either, but I could see the advocation for taking it before, because when we eat, it kills the bacteria and then the LPS gets released. So if you're taking Megaspore before or during a meal, you can kind of counteract that.
Okay. How can one gain the understanding of how strong, thick, or weak, thin their mucosal barrier is, and their formal testing signs for these, which is basically leaky gut? True?
Right.
Yeah.
Yes. I think that if you wanted to see exactly how that mucosal barrier looks, I mean, a colonoscopy is one just the main way to kind of get in there and take a look. But you could use a stool test to see if you have any bacteria or toxins that are known to break down the mucus.
And also, typically your colonoscopy, in my experience, isn't going to tell you if you have leaky gut, but
Correct.
because there's your blood test for zonulin, another possibility. What is the difference from Clostridia to C. difficile? And is it Chloridia is the same bad? I'm not sure. Do you help
Yes,
me?
I think I understand what they're asking.
Yeah.
So Clostridia is the genus of bacteria, and then you have a lot of different species. So Clostridium, or in strains, excuse me. Clostridium difficile is a pathogenic strain of Clostridium that's associated with C. diff. And then Clostridium scindens is a bile acid metabolizer that helps us break down bile acids. So the Clostridia phyla is not necessarily, or excuse me, genus is not necessarily a bad one. It's the different individual strains that can be good or bad.
Okay. Let's see. In what way does hormone replacement therapies positively or negatively affect the bacterial growth and virulence? Also, what is meant by decreased virulence? That's a mouthful.
Very good question. I'm going to start with the last question and work my way up.
Okay.
So when we said in the slide that certain hormones are associated with decreased virulence, our hormones like estradiol and progesterone can impact how pathogenic bacteria are. So whether or not they release or make certain toxins. Now, I haven't been able to get into the research to see specifically if there are studies that show that bioidentical hormones or hormone replacement therapy is associated with, gut dysbiosis and worsened pathogens. So I can't speak to that without getting into the research. But our hormones, particularly estrogen, does play a huge role in our bacteria.
Okay. Let's see. Okay, thank you. By the way, okay, so how is the enteric nervous system, the total number of neurons, impacted when an intestinal resection occurs? Are there knock-on effects on cognition, mood, or other that would follow after the surgeries typically?
That is a very good question. So I would imagine that it wouldn't necessarily impact cognition because the enteric nervous system operates independently of the CNS, central nervous system, and the peripheral nervous system. But I would imagine that, of course, it could impact gut motility if only a piece of the colon was taken out and then there's, pieces remaining or parts of the colon remaining. So I wouldn't expect neuronal or cognitive impacts, but definitely impacts with gut motility.
Caroline's saying in the UK the discount isn't working. That might be true. I don't know. What I would say is that typically you can only order from Microbiome Labs through a practitioner. So at the very least, this at least gives you access. So I'm so sorry about that. Can you talk about parasites, worms from the gut entering your brain and how to rid them from the brain? That's a reach, but go ahead, Sarah.
Yeah, I wish I could, but I don't have enough expertise in that area.
Let's see. We talked about that one. Okay. Can you speak about what happens to the vagus nerve and the nervous system functions and overall gut microbiome if one does an extended medically supervised water fast, like 2 to 4 weeks long? Wondering what systems would be set back or forward as a result, as well as the effects on the gut microbiome diversity. One thing I need to say is that remember, everyone has a snowflake microbiome in that everyone's is totally different, obviously, but worth repeating. So just comment on that. Have you seen any results or people who have done that kind of a long medically supervised water fast?
I haven't, but I'm intrigued and I actually want to go climb into PubMed and see what we can find.
That is a great suggestion. Go to PubMed if you haven't gone there. It is a rabbit hole, I warn you.
Yes, it is. Yes. You'll get stuck in there.
Yeah, exactly. Hope to see you again soon, kind of thing.
Exactly.
Okay. Is there a way to measure the efficiency or lack thereof of their gut-brain communication axis?
A stool test would be good because then you can see the diversity, whether or not you have a lot of pathogenic and non-pathogenic bacteria. Looking at your indole levels. So remember, we talked about tryptophan metabolism, and tryptophan can be used to make indole. And so if you have a lot of indoles, that's usually a sign that you don't have enough tryptophan to make serotonin and melatonin. So that's something to look at. And really, other than that, you can rely on your symptoms. So, seeing how your symptoms have responded to different treatment modalities.
I don't think it's common to have skin issues from taking Megaspore, but absolutely, if you do, stop. That's your body telling you something, and start very, very slowly. That's the biggest feedback I hear, is that I tried it. It was, it was almost like I had a reaction. And I know other people that can take 2 at a time day one and they're fine. But also my community often tends to be sensitive. So start very slowly.
And add in an immunoglobulin binder, and oftentimes skin issues is a sign of die-off.
Okay. Do probiotics help with viral infections? I would say yes, because you have a viral biome too.
A viral, I think that's what they call it. So I would say that it could impact the composition of the type of viruses that are there, but I can't speak to like a specific virus and how probiotics affect a specific virus.
Okay. The name of the stool test is, I'm saying it right? Biome FX?
Biome FX, correct.
Okay. It's F as in Frank, X as in X-ray. So look at it. It's on the website there. Let's see. Here we go. How do traumatic brain injuries events, and that's very smart that you're saying that they're events because they are cumulative and they are events. It's not just, oh, I had a car crash and I was bleeding from the ear. They're horse kicks, they are falls, they are whiplashes, they are cumulative. What could those individuals do right after an injury to preserve and retain as much functionality in the body long term?
I did do some research on traumatic brain injuries and the gut microbiome, and they found that within hours of a traumatic brain event, it changes the microbiome in terms of the number of bacteria that's there, as well as the quality. So I would focus on rebuilding the microbiome, like with the total gut restoration kit that we have at Microbiome Labs has all 3 products that you would need to rebuild that microbiome and strengthening that gut-brain connection as well.
Total gut restoration kit. You can put that up there. Okay, let's see. Hold on. What are the clues that LPS is being translocated?
It's common signs of leaky gut.
I say brain fog. I don't know what you. I say brain fog. What do you say?
Brain fog, skin issues, food sensitivities. Issues with digestion, changes in bowel habits, diarrhea, bloating, constipation, all those things.
If you don't have leaky gut, would it not be a problem since LPS wouldn't get into the bloodstream?
Can you repeat the question? If you don't have LPS?
If you don't have leaky gut.
Oh, okay. Okay. Well, if you don't have L or leaky gut now, having LPS free in the lumen or in the opening of the colon will cause inflammation and eventually lead to leaky gut. So even if you don't have it now, having free LPS in your colon increases your risk of having leaky gut.
Okay. Okay. Is all gut brain communication via the vagus nerve? If not, how else does it communicate?
Mostly the gut brain, yes, is facilitated through the vagus nerve. Now, occasionally, again, hormones travel through our bloodstream. And so there are hormones that can cross the blood-brain barrier, like we talked about with ghrelin. So that would be another way that the gut is able to communicate with the brain, but primarily it's the vagus nerve.
You mentioned earlier heavy exercise could negatively impact the microbiome. Is that through too high a level of cortisol that has systemic effects on the gut lining or other areas of the gut? How does that play out?
I'm glad you asked. So chronic cortisol leads to an overexpression of a pro-inflammatory cytokine called IL-6. Now, IL-6, if we're having a lot of that being churned out, it actually hides. It makes the glucocorticoid receptors hide. So the same receptor that binds the cortisol, that cytokine makes it hide. So that means you have constant cortisol, constant inflammation, and then that is what leads to like gut-brain issues and all of those sequelae.
Let's see. Okay, I'm gonna ask that we wrap up I'm gonna keep going with the questions, but please try not to submit any more because I'll never finish. Okay, hold on. Oh, let's just talk about diet quickly.
Yes.
What's the best diet to diversify your microbiome?
I'm not sure if there's a specific diet, but there is a specific type of food, which is dietary fiber. And I know folks are like, oh, everyone talks about fiber, but fiber is so important. It's the food for our bacteria. Our bacteria cannot do anything for us if we don't feed them with the fiber. So making sure you're having enough of it. So, even folks following the carnivore diet, I know it's frowned upon to have fiber, but your bacteria definitely need it.
Okay. To what extent could interstitial cystitis be corrected with your products? That's kind of a claim of a cure, so I doubt we can really address that. But getting your microbiome in shape is steps in the right direction. And if you have IC, definitely look at a lab called MicroGen-Dx. Are you familiar with them?
I'm not actually, but I'm going to write that down. MicroGen-Dx.
I think it's DX. This is a lab that will, like, if you have a UTI and you go to the urologist or even the gyno, they will culture the urine, and then they come back and they're like, well, you don't have, blah, E. coli or whatever overgrowth, or you do, but there are so many other pathogens that could possibly be causing this. Yes. And they do not test for as many as MicroGen-Dx does. Ooh. So it is known to really cover a huge spectrum. So a friend of mine who's elderly, tons of UTIs, couldn't figure out what it was. Yeah. Credit to the urologist who had a little brochure on the desk. Wasn't his main jam, but she did the test, found out it was something else, and they were able to treat it, and it fixed. And Erica is saying if you have IC, that can be the caused by mycoplasma and ureaplasma. Okay, we have to keep moving.
Yes, I have heard that.
Yeah. Okay. Let's see. Are there any tests for enzymes?
I'm not aware of any tests for enzymes. I'm sure there may be. I would have to look into them.
What happens to the GI system if vitamin D is very, very, very low?
Very good question. So essentially, vitamin D is a prohormone that does play a role in gut health. It impacts our ability to absorb calcium and can impact how calcium is used in the body, and that can play a role with heart disease as well. So I would expect to see low diversity, as well as a shift in more pathogenic bacteria compared to healthy bacteria, and low short chain fatty acids potentially.
Okay. How do you spell this company? It's right there in the chat. I will repost it. It's Microbiome Labs. Copy. I'm going to put it in the chat. Please find it in the chat. All the information's right there. And you have to register as a patient direct with SIBO SOS. Okay, so that's there. Okay. What could be causing chronic burping at night if negative for SIBO? Oh, darling, there are so many things that cause gas. So many things.
So many.
SIBOs. Yeah.
H. pylori.
Yeah.
Mhm.
Probiotics, prebiotics.
Yeah, I know. Food, anything.
Food. Yeah. Okay. Which infections uncontrolled by the gut would result in what types of damages to the blood-brain barrier? And with that, potentially impacting parts of the brain as well. That is a huge, wonderful question. I think it's a little too broad, but one book I would definitely look at is out right now by Dr. Partha Nandi, Nandi. I see it right here. And it's Heal Your Gut, Save Your Brain. That's a brand new book out. It actually may be pre-launching. So
Heal your gut, heal your brain.
Says heal your gut, save your brain.
Save your brain.
They sent me a pre-release copy, but Dr. Nandi's got his act together. He's very smart. He's a GI. Mahamud, I don't know. Send me an email at info@SIBO.SOS. Thank you for, or if that's what you wanted to ask Sarah about. The microbiome changes hourly.
Yeah.
Literally hourly.
Yeah.
Okay. What helps acid reflux?
So many things. Diet, of course. Trying to decide if you have enough acid or too much acid. Oftentimes, acid reflux is caused by not having enough stomach acid, which is interesting because they prescribe PPIs to help with acid reflux. So yes. And then one of our products, Mega Guard, it has ginger and artichoke leaf extract and licorice, and is able to support upper GI complaints like reflux.
Okay. Can we use probiotics or other strategies to affect the lung microbiome, or is it mostly all based on how much we spend out in nature and the quality of the air we breathe, impacting what bacterial species anchor and populate the lungs?
I think it's all a mix. Yeah, absolutely.
Does TMA also get converted to TMAO? Can you remind us what that is again? And we'll go for 5 more minutes.
Yes. So TMA is what our gut turns our eggs and cheese and steak into. So the choline and carnitine gets turned into TMA. TMA is totally fine. But when TMA goes to the liver turns it into TMAO. And TMAO is the thing that has been associated with type 2 diabetes, metabolic syndrome, and heart disease.
Okay. Have you noticed any changes in Parkinson's patients with dietary change? If so, what are those changes and by how much? And please look up Dr. Greg Eckel online. If you I don't know how to spell his last name. Dr. Greg Eckel is a naturopath who is an expert in Parkinson's and has great results.
Awesome.
Any changes that you've noticed?
I don't work with a lot of patients with Parkinson's, so I don't have much to contribute to that.
Okay. Let's see. Does Microbiome Labs offer any products for coronary issues or other clogged arteries and other cardiac issues?
While we don't have any products specifically for heart disease, we do know that Megaspore has been shown to decrease triglycerides, so it has a healthy impact on cholesterol, which is often a root to heart disease. So Megaspore is a great option. Our K2 products have been shown, vitamin K2 is very important for healthy calcium, so it can pull calcium from our vasculature and deposit it into our teeth and our bones. So those are two of the products that I would use to support a healthy heart on top of, good dietary fiber, prebiotics, and those things.
Does dysbiosis have any connection to chronically elevated cortisol?
It could, in the sense where the gut inflammation is kind of driving that feedback loop that I talked about earlier between cortisol and leaky gut and IL-6. So it could kind of facilitate the continuation of that, but I'm not sure if it's necessarily a primary cause.
Okay. Let's see. Ooh, also, if you can share, I know I'm going to do that one. Beside taking probiotics, what should one do after taking heavy course of antibiotics for H. pylori?
Ooh, okay. So definitely, I would say Restore Flora. That's one of our 3 probiotic products. It's a combination of 2 spores and Saccharomyces boulardii, and it's designed to go along antibiotic use. And honestly, after you've gone through antibiotics, the total gut restoration kit is perfect to follow that up, because you are going to want to rebuild the gut after a round of antibiotics.
Robin Colby, one of our regulars here, wanted me to hold up the book. So this is Heal Your Gut, Save Your Brain by Parthenandi. Looks like a quick, easy read. And I don't know if it's literally out yet, but I think you can pre-order it on Amazon. The code for 15% off is no bloat 15. And you have to register as a patient with the code, patient direct code SIBO SOS. Okay. Oh my gosh, y'all have such great questions. We have 10 left. What do you say to people? I'm not going to make it, but what do you say to people who have Crohn's? What can help them?
When I think of Crohn's, the first thing I would do is do a stool test to make sure that we are addressing bacteria like fusobacteria that's associated with inflammatory bowel disease. And then what we know is that the mucosal layer is mostly impaired when it comes to inflammatory bowel disease. So a product like Mega Mucosa would be great to help rebuild that mucosal layer and support that. So those are kind of BiomeFX, spores, and Mega Mucosa.
Okay. Excuse me. We just did that one. Pardon me. Okay. Cancel, answer live. I have to take a sip. Okay.
No worries.
Through what mechanisms, for what reasons does metformin result in higher of the good bacterial species? Not sure how any pharmaceutical could produce these goods. I'm not sure.
Yeah. So metformin actually helps facilitate the growth of the bacteria that help make butyrate. The actual mechanism of action, I have to look into to get into the specifics. But rather than other anti-diabetic herbs or drugs that focus on, increasing insulin and driving, healthy blood sugar, metformin acts on the gut.
Okay. Let's put some love into the chat for Sarah. Great job, Sarah. Thank you so much.
Thank you for having me. It was great to chat with you all.
What a pleasure. What a pleasure.
Thank you.
So take care. Erica's saying that you read Jordan Rubin's book and he had Crohn's and said that soil-based probiotics saved him. So spore-based is Megaspore. Thank you all so much. Do take advantage of that coupon. Do try to order by 5 p.m. So it's 40 more minutes. And then you would be getting a link to the slides. And then Kiran Krishnan, who is the co-founder of Megaspore, I always call it that, Microbiome Labs, his really interesting talk about spore-based probiotics. And he is an incredible educator and teacher. I do have him coming up, by the way, I'll send you an email, July 18th.
Wonderful.
Coming up talking about SIV, which is his topical skin serum. for acne, psoriasis, eczema. They're in the process of doing a lot of research right now about that. I know someone was asking about psoriasis. It's an inside job and an outside job for sure. Microbiome related for sure. I know because my sister has it and I have a little bit of it, and it's just getting so much better. Thank you all so much. Mwah, 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 mwah. If the coupon code didn't work, said it's expired. Has anybody else had luck with it? Thanks, everybody. That was fantastic. Thanks, Sarah. Oh, thanks, Zoom user. Thank you both.
Thank you, man.
I'm assuming some people have had luck with it. If it was expired, you know what? Email us if you're having any issues. Ultimately, we will be sending you to the customer service at Microbiome Lab, possibly. But can anybody? The Zoom user said code worked fine. Oh, Sarah, can you just help me find the customer service for Microbiome Labs? I'd really appreciate it. I know it's info overload, but so worth it. Thanks, Karen. We will be sending you out the replay tonight. And it is so much. Play it in the background. If you are a better reader, you can get that app, Otter. They have free transcription for you. You can read it. That's another way to help you out. And how do I send proof of love? Just put some heart into the chat. Oh, the UK, I don't think the coupon works. It's always been kind of hit or miss. But Sarah's getting that for us for the
number. Let me get the email for you.
Ooh, I don't usually see that phone number, Sarah.
Ooh, well,
good to have. I'll be putting that into my little secret stash of resources here.
Actually, that one is if you're calling from international. If you're calling from the US, here's this number.
Okay.
94940.
Okay, thank you. We could probably have Googled this. Why proof of purchase? Well, because if you want the bonuses, then you need to send me the proof of purchase, because the whole thing is an incentive for you to take advantage of this, that little kick in the booty and little nudge to help you. So if you want to take advantage, look, after 5 p.m. tonight, the 15% off is still going to work for a couple of days. But if you want the slides and you want the masterclass or the conversation I had with Karen about spore-based probiotics, that is to be sent to us with proof of purchase by 5 p.m. Eastern time. You place your order, be sure to get us the proof of purchase tonight. It'd be great to have it right away. And then we'll give you the link to those bonus resources. Okay, thank you all very, very much. And by the way, this number is findable online. So if you don't catch it right now, don't worry. MBL customer service inside USA. Okay, we will wrap. Thanks, Sarah. Thanks, everybody.
Thanks so much.
Bye-bye. Bye, Sarah.
Bye.
Here's where you send the proof of purchase. It's to info@SIBOSOS.com. And then give us a few and we will send you the link so you can get those bonuses. Okay, that was terrific. We have Karen Krishnan, the co-founder of Microbiome Labs, coming in next Thursday, the 18th of July, 2024 at 3 p.m. Eastern time for a presentation about the skin microbiome with a topical spore-based probiotic serum that he has phenomenal results from, and studies for acne, eczema. They're working on studies for wrinkles, anti-aging, psoriasis, and a few other skin conditions. I used it topically, and it's not just like opening a megaspore and putting it on topically. I've tried that before, but this really, really is working gorgeous, beautifully. All right. Thanks, everybody. Take care. Hope to see you next time.